Okay, so first I will ask you your name and your position here at Lionsgate.
My name is Barbara Moore, and I'm a certified respiratory educator and respiratory therapist here at Lionsgate Hospital.
Great. And we're going to talk a bit today about asthma. What exactly is asthma?
Asthma is a chronic lung disease. We don't really know what causes it, but we know there's a big association with allergies and hay fever. It's often inherited, runs in families, and how it presents is a patient will have chronic cough, wheeze, shortness of breath, bringing up mucus that comes and goes with the seasons or with other triggers.
Okay, and what is the September spike?
The September spike is when the kids go back to school and they've been away from each other and oftentimes off their medications over the summer because they feel better then. Then they all get back together at school and they share germs and they're stressed and the weather changes and there's this spike in asthma, and it's about 17 to 18 days after they go back to school. So the school kids present in the emergency room at that time, and then about a week after that, their siblings and the daycares get it, and then about a week after the littler kids get it, adults have a spike in asthma.
So it lasts into September then?
It's full last 2 weeks of September.
Okay, great. And why does this happen? You talked a little bit about that, but what are the contributing factors?
Children being off their medications over the summer. Parents don't like to keep their kids on their inhaled corticosteroids over the summer. They feel like giving them a break is a good thing to do. Worried about side effects of decreased growth and things like that. So they take their kids off their medications for the summer and don't start them again before they go back to school. So if they stayed on the medication all that time, or at least started a few weeks before back to school, then they may not have this flare-up, even though they're back with all the kids and the viruses and the change in the weather.
So would your recommendation as a therapist be for the kids to stay on throughout the summer?
The Canadian Thoracic Society guidelines don't recommend kids going on and off inhaled steroids. They say to keep them on a low-dose inhaled steroid all the time.
Even if they feel better?
That's probably why they're feeling better, is because their medication's working, really.
Okay. So besides remaining on their medications all year round, what can parents and children do to minimize the risks at this time of year?
Lots of hand washing. Make sure they get lots of sleep. It's a really stressful time for kids going back to school. It's exciting, but that's one kind of stress, but it's also stressful. Avoiding other triggers they might have. So not being around their friends' pets if that's a problem. Mostly it's just taking their medications properly and regularly.
Okay. Are there warning signs or behavior changes that teachers, parents, caregivers should watch for that they're...
The asthma's not being well controlled. A cough. Kids don't cough all day, all night. So that's a big sign with kids, is coughing. And for parents, is coughing at night. So if the kids are coughing all night, something's not right. And if they're coughing all night, they're not sleeping properly, so they're going to be really sleepy at school the next day. So if the teacher noticed that a student is exceptionally sleepy for a few days, they should let the parents know or just ask, what's going on with the sleep?
So if a child has not presented with asthma before and they're starting to cough a lot more, that could be a sign that they're developing it?
Coughing, wheezing, mucousy chest. Oftentimes it presents with allergies or on the playing field with exercise. So in a child that's been perfectly fine before, if they get a cold and the cough goes on and on and on, or if they all of a sudden become allergic and they're coughing, or coughing a lot with exercise, that's a sign that they may have asthma.
So what is the difference between coughing for a normal amount of time that would just be a viral, like if it goes past a certain amount of time?
Colds, typical colds usually last 3 to 7 days. So if it goes on for a month, It could just be a post-viral cough, or it could be a symptom of asthma. So how to figure out that is to send the child for breathing tests, for spirometry testing in one of the labs. Kids over 6 can usually do the test pretty accurately. A lot of times what doctors do is just a trial of medication, and if it works, you're pretty sure of what you've got. So in the littler kids where we can't do breathing tests, it's history and a trial of medicine to see if it helps.
Okay. How can teachers help and what should they know?
Teachers can help by educating the whole class about what asthma is, so there's no stigma. So the child that might have to take their puffer at school before gym, which would not be a well-controlled asthmatic, but so the child doesn't feel like a pariah for taking this medicine, right? And teaching everybody about allergy and asthma and what you can do with asthma, that it's not an emotional problem, that it's an actual physical malady, and just to be there to support the child, because at home and when they're younger, parents tend to give the child the medication. When they go to school, they're expected to take it on their own. So if the teacher can just be a little bit helpful and welcoming with that, that goes a long way to make the child feel not like they're sort of special.
What percentage of children, say in elementary school, have asthma?
The percentage of Canadian kids with asthma is about 15%. So in any given age group, 15% of children will have asthma. In adults, it's lower. It's, I think, between 5 and 6% in adults, but higher in kids.
And do you see that increasing?
It is increasing. The incidence of asthma is increasing. And there's lots of theories why. One is that we don't have enough exposure to viruses and illnesses as children, because everything's so clean that we're not developing our immune system as well. That seems to be one theory, but it is going up. And we've got great treatments that we know work, but the prevalence is still increasing.
What are the warning signs that an asthma attack is about to occur?
So asthma is considered controlled and uncontrolled. And attacks are the far spectrum of uncontrolled. So if you have asthma and you're having symptoms less than 3 times a week, symptoms considered cough, wheeze, shortness of breath, mucus, if it's less than 3 times a week, that's considered pretty well controlled. If you're having symptoms more than 3 times a week and need to use your rescue inhaler, that's considered uncontrolled. An attack is when you're taking your rescue inhaler and it's not helping, you're not getting any relief.